Have you ever heard about thalassemia? Well, if you have just know its name, then this is right video for you. Watch this video till last. Hello guys, this is Sam and welcome back to Science Grid. Let's know some interesting information about thalassemia. Let the learning begins. World Thalassemia Day is celebrated every year on May 8th to commemorate thalassemia victims and to encourage those who struggle to live with the disease. Thalassemia is an inherited blood disorder that causes your body to have less hemoglobin than normal. Hemoglobin enables red blood cells to carry oxygen. Thalassemia can cause anemia, leaving you fatigued. Thalassemia is genetic in nature. To develop full thalassemia, both of your parents must be carriers of the disease. As a result, you will have two mutated genes. Thalassemia is inherited, meaning that at least one of your parents must be a carrier of the disorder. It's caused by either a genetic mutation or a deletion of certain key gene fragments. There are two copies of the hemoglobin alpha gene, HbA1 and HbA2, which each encode an alpha chain, and both genes are located on chromosome 16. The hemoglobin beta gene, HBB, encodes the beta chain and is located on chromosome 11. In alpha thalassemia, there is deficient synthesis of alpha chains. Beta thalassemia is caused by mutations in the hemoglobin beta, HBB, gene. We will talk about this afterwards. When thalassemia is called alpha or beta, this refers to the part of hemoglobin that isn't being made. If either the alpha or beta part is not made, there aren't enough building blocks to make normal amounts of hemoglobin. Low alpha is called alpha thalassemia. Low beta is called beta thalassemia. Symptoms of thalassemia. The symptoms of thalassemia can vary. Some of the most common ones include bone deformities, especially in the face, dark urine, delayed growth and development, excessive tiredness and fatigue, yellow or pale skin. Thalassemia occurs when there's an abnormality or mutation in one of the genes involved in hemoglobin production. You inherit this genetic abnormality from your parents. If only one of your parents is a carrier for thalassemia, you may develop a form of the disease known as thalassemia minor. If this occurs, you probably won't have symptoms, but you'll be a carrier. Some people with thalassemia minor do develop minor symptoms. If both of your parents are carriers of thalassemia, you have a greater chance of inheriting a more serious form of the disease. Normally shaped red blood cells are a sign of thalassemia. The lab technician may also perform a test known as hemoglobin electrophoresis. This test separates out the different molecules in the red blood cells, allowing them to identify the abnormal type. Blood tests can reveal the number of red blood cells and abnormalities in size, shape or color. Blood tests can also be used for DNA analysis to look for mutated genes. Molecular diagnostic test includes PCR. The treatment for thalassemia depends on the type and severity of disease involved. Blood transfusions, bone marrow transplant, medications and supplements, possible surgery to remove the spleen or gallbladder. Thalassemia prevention. Individuals with thalassemia need to consult the doctor and opt for the genetic counseling. This will give an idea on how to reduce the risk of thalassemia transmission to their kids. Prenatal tests are recommended to detect thalassemia before birth. The genetic counseling should be given to the parents carrying thalassemia genes. They should be given detailed information about this disease and proper guidance should be provided to safeguard their child from this disease. If you find this information useful, please leave a comment and hit the like button. This encourages us to make more videos like this. On the basis of response to this video, I will make detailed information about this. Please comment your view. Thank you for your time.